Dr. David Green, CEO of the California Pain Network. The topic today is the basics of disc bulges and disc herniations. When you look at the normal intervertebral disc, it's about 80% water and 20% is proteins and collagen. There are two areas of the disc, and you can see a cartoon of one here. I like to look at it as basically a jelly donut. The outer part of the donut is called the annulus fibrosus, and it does have nerve endings. You can actually feel pain if you have some tears here. The inner jelly part is called the nucleus pulposus. It has no nerve endings at all, and you can't feel pain from it. The disc acts as an excellent shock absorber when we walk, run, jump. Basically, it gets squeezed and water squishes out of it, and then it quickly gets reabsorbed, so it really does absorb stresses nicely. When disc degeneration occurs, it's usually between the ages of 20s into the 50s, and it can be due to obesity, smoking, repetitive trauma, genetics plays a part, and then there's social environmental factors, such as if you're a truck driver, those occupational hazards, those have a higher incidence of degenerative disc disease. And what happens is it all starts with the fluid. So you start to lose fluid in your disc, it turns into a prune, and then you lose height in the disc. And you can see that here. You have a nice healthy disc which is sort of rectangular, and then you start to lose water and it starts to lose height and bulge out, kind of like a tire that's getting flat, okay? And then right here you can barely see it at all. It's almost bone on bone. When that happens, little tiny tears and cracks can occur in that outer part of the jelly donut, the annulus, and that can cause pain. It degenerates and loses air. It's akin to, as I mentioned, a tire that's losing air and starts to bulge. You start to get these disc bulges. You can see one here, and it can pinch on nerve roots and be painful in and of itself. 35% of those between the ages of 20 and 40 have degenerative disc disease and no back pain at all. So what that means is you could have an MRI that looks like this, where you have some disc degeneration, and it may not be painful in the least. So a disc herniation, I'll show it to you on this cartoon. You have a normal looking disc here, and then you can start to get a disc bulge, okay? So there's no tears, but the disc is bulging with degeneration. Then you can actually get a tear, where there's a tear on the annulus and the inner jelly squeezes out, okay? You can see that here and here, but what happens is it can pinch on this nerve root as it's trying to get out, all right? That's called a herniated disc, a slip disc, herniated nucleus pulposus, herniated intervertebral. There's a lot of names for it. They all mean the same thing. So what are the symptoms? Well, most disc bulges are not painful at all, okay? It doesn't irritate any nerve endings, and you don't even know that you have it. But if it does irritate those nerve endings in the outer part of the disc, it can cause back pain. And if it's causing irritation in the adjacent nerve root and inflammation, it can cause pain called sciatica. And you can see it here. It can go down the leg, the back of the leg, the calf, maybe the outer part of the calf. It depends on which nerve root we're talking about. It can also lead to muscle spasms and aching in the back of the leg as well. Now, if you're actually pinching on a nerve, it can also lead to burning, searing pain, pins and needles with numbness, motor weakness. Rarely it can lead to incontinence. That becomes a surgical emergency. So how are disc bulges and herniations treated? Well, if it's not that bad, the pain, you can just kind of watch it and ignore it. It's called benign neglect. For mild pain, over-the-counter medications such as Tylenol, nonsteroidal anti-inflammatories can be helpful. Physical therapy can be very helpful for relieving the pain from disc bulge or herniation. Chiropractic treatment has its place. Spinal decompression therapy is intermittent spinal traction that's computerized, that's been shown to have over an 85% good to excellent results for weeks to months. And then acupuncture can also be very helpful. When it comes to prescription medications, a Medrol dose pack is a burst of prednisone for 5 days. That can be exceptionally helpful, but you really don't want to do that but every few years, very sparingly. Narcotics and non-narcotic medication like tramadol can be helpful if it's necessary and it's bad enough. Muscle relaxers, neuropathic medications such as Neurontin or Lyrica can be very helpful if a nerve root is being irritated. And then you have topical medications, which are coming more and more to the forefront because they have excellent pain relief in over 80% of individuals, but they don't get into the bloodstream. There are several interventional treatments that can be exceptionally helpful for disc bulges and herniations. One is trigger point injections. These are subcutaneous little injections that can relieve the muscle spasms and the aching. Intradiscal injections, which would mean that the needle actually goes into the disc here with steroid medication. You might not think that would work very well, but it actually works exceptionally well. It can give months of pain relief. And then here you have an epidural injection. There's a nerve coming out, the yellow. It's being pinched by this disc herniation. So an epidural injection puts the steroid medication right around that where it's pinched, and it's like a soothing anti-inflammatory bath. And that can give pain relief for weeks to months. It doesn't fix this problem, but it can give relief long enough to where hopefully this little piece of disc just disintegrates away. What are the outcomes? Over 75% of those with degenerative discs and symptoms are able to avoid the need for surgery. When it comes to those with sciatica, over 95% are able to avoid the need for surgery. So with sciatica treatment, outcomes are very, very good non-operatively. They actually showed that in a 2006 study in the Journal of the American Medical Association. They looked at the outcomes of disc herniations at 1 year between those who were able to be treated non-operatively and those who had surgery. The outcomes were no different. But the ones who didn't have the surgery were able to avoid those potential complications. For pain management in California is with the California Pain Network. There are several clinics throughout California, including San Diego, Oceanside, Orange County, LA, Bakersfield, Inland Empire, and all the way up to San Francisco. There's over 50 insurances that are accepted, including personal injury, workers' compensation, PPOs, some HMOs, Medicare, some accept Medicaid. There's over a 90% success rates overall. The doctors are board certified, award-winning, and they offer over 25 different treatment options. Visit us on the web at californiapainnetwork.com and then call us for more information and scheduling at 877-877-8556. Dr. David Green with the California Pain Network. Your pain stops here.